I'll let you get up there and then I'll. Senator Monty, I apologize. I should have checked to see who was ahead of you. It's my fault for
No, I
going in
understand.
front of
I'm
you.
glad to accommodate. There are a lot of people here from out of town.
And I know, yes, so.
Just a heads up would have been
No,
appreciated.
it was my fault because I didn't realize, and I should have asked you, because like I asked Bates before, so, but it's my apology, and I do it, my fault, I'm sorry. And it's a long, and you know, let's blame Senator Mitchell. Let's blame Senator Mitchell.
Everybody needs to recognize the deadline hearing, so come, bring your lunch, be prepared today. My witness to this week.
Thank you, Mr. Chair, and I do want to thank those who have patiently waited. I know we had some students who had to leave, but we have a long agenda, and I appreciate the opportunity now to present SB 203. Members, we're in the midst of a diabetes and obesity epidemic that is wreaking havoc on the public's health and driving up healthcare costs. Over the past 30 years, we've seen adult diabetes and obesity rates double, triple for adolescents, and quadruple among children. What used to be called adult diabetes, adult onset diabetes, we're now seeing in teenagers. By doing nothing to address this epidemic and ignoring the leading contributor, we are putting Californians at risk to life-threatening conditions that will result in the first generation in our nation to have a shorter life expectancy than their parents. The evidence is conclusive. Sugar-sweetened beverages, a major source of excess calories that often provide no nutritional value, are the biggest contributor to this problem and are distinct from sugars found in solid foods. Senate Bill 203 is a critical component in a broader public health campaign to promote better health outcomes and help consumers make an informed choice about the known adverse health effects of sugary drink consumption. Specifically, SB 203 would require a health warning label to be placed on sugar-sweetened beverages such as sodas, sport drinks, energy drinks, and sweetened teas, which contain 75 calories or more per 12 ounces sold in California. The label is based on the science stating, quote, drinking beverages with added sugars contributes to obesity, diabetes, and tooth decay, close quote, statement of fact. Science has proven that sugar in liquid form is absorbed much more rapidly by the body, and these drinks pose a greater danger to public health than the same sugar in solid foods. The unique rush from a sugar-sweetened beverage spikes blood sugar levels and overwhelms the body, forcing the liver to convert it into fat. This fat then builds up in the liver, which then leads to the development of preventable diabetes. Members, studies show that drinking one sugary drink a day increases an adult's likelihood of being overweight by 27% and a child's by 55%, while increasing the risk of preventable diabetes by 26%. Opponents say my bill is misguided and will confuse consumers, but the analysis points out that research from the Rudd Center for Food Policy and Obesity shows quite the opposite, that beverage advertising encourages parents to make unhealthful choices for their children. Opponents will say that this bill hurts jobs, which also means they must think the label warning will work, which goes against their arguments that the label warning won't work. While it is true that the label is meant to reduce consumption of sugary drinks, that reduction would not result in lower purchasing or less jobs because consumers will simply choose a healthier option produced by the same companies or their competitors. The scientific evidence is clear. Sugar-sweetened beverages are fueling the youth diabetes epidemic and a host of other health and dental decay issues. It's time we take a step to provide that vital information so people can make informed beverage choices that might actually lead to healthier choices and in turn lead to better health outcomes for the people of California. Members, I appreciate your consideration, and with the permission of the chair, would like to present those testifying as co-sponsors of SB 203, Dr. Harold Goldstein, Executive Director of the California Center for Public Health Advocacy, Darcel Lee, Executive Director of the California Black Health Network, and Nancy Mejia on behalf of the Latino Health Access. Thank you, Mr. Chair.
Thank you. Please proceed.
Dr. Hernandez and members, I'm Dr. Harold Goldstein with the California Center for Public Health Advocacy. As the Senator said, most people have no idea how really harmful these sugary drinks are. And we're not talking just about Coke and Pepsi, soda pop. We're talking about sports drinks and energy drinks, Capri Sun and Sunny Delight, lots of products that sure sound healthy. And when you look at the label, it sure looks like it's healthy, but it's not. As Senator Monning said, we are in the midst of a diabetes epidemic. One 20-ounce soda has 16 teaspoons of sugar. Imagine eating 16 teaspoons of sugar. That much sugar absorbed as quickly as it is because it's in liquid form does, as Senator Monning said, overwhelm the pancreas, wears out the pancreas over time, and is converted into fat in the liver. Kids now are being found that have the equivalent of fatty liver disease as if they were alcoholics. They're not alcoholics because they're drinking alcohol. Their liver fat is showing up because they're drinking sugar. 30 top scientists from around the country have all signed on to support these warning labels. These are top researchers from Harvard and Stanford and UCLA and USC and UC Berkeley. Over the last year since we were talking about this bill, warning label bill, at this time last year, another 13,000 Californians have had their feet or legs amputated because of diabetes, a foot or a leg. 90,000 more Californians now need kidney dialysis because of diabetes. All in all, these sugary beverages represent half of all the sugar consumed in America. And perhaps most importantly, 74% of voters in California say they want and support warning labels. You know, our center took the lead in advocating through this body to get soda and junk food out of schools. The beverage industry at the time said, this is a job killer. We're going to lose jobs if we take soda out of schools. A couple years later, the beverage industry put full-page ads in newspapers across the country taking credit for taking sodas out of schools. The single most important thing we can do to get ahead of this obesity epidemic is to let consumers know that this product filled with sugar is a leading contributor. I encourage your aye vote.
Good afternoon. I'm Darcel Harris-Lee, President and CEO of California Black Health Network, and I appreciate the opportunity to again address you. While I'm not going to dwell on a lot of the statistics that you've heard from both Senator Monning and from Harold, there are a few numbers that I believe are so outrageous that I'm compelled to share them with you today. In our community, the African American community, 19% of African Americans have diabetes. Half, and I want you to hear this, half of African American children will develop diabetes within their lifetime. 40% of African Americans who are hospitalized in this country have diabetes. Imagine the cost to our healthcare system. And 74% of African American teens in California drink one or more sugar-sweetened beverages every single day. The consumption rate is higher among African Americans than any other ethnic group. This is real, and it's about real people. The statistics I know are important, but I want to share with you that I worked with a young lady in our church's ladies ministry program. This young woman was 17 years old. She already had diabetes. Her family had diabetes. Her aunt, her mother, her father, her cousins, they all had it. And all of them were addicted to sugar-sweetened beverages. This young woman was drinking 2 before noon, 2 between 2 and 4 o'clock, 2 before and another 2 before midnight. After explaining to her that she was drinking 96 teaspoons of liquid sugar a day and educating her about what this meant to her liver and her body and her overall health, she began to make some changes. It took educating her and providing her with some specific knowledge to inspire her to redirect her product choices and ultimately change her behavior. The prevalence of diabetes in this country is a public health outrage. It's an outrage because it is a preventable disease. You know, over 30 years ago, my predecessors at CBHN sat before a committee similar to this one in the state legislature. They were pleading for a label to be placed on a package of cigarettes that they were citing similar statistics about as those I've shared today. They were fighting for the lives of our young people. So why are we making this so difficult? We found out then that 30 years ago, that we were saving lives. And if we are so wrong about this, and I don't believe we are, then what's wrong with erring on the side of caution? Because we're talking about the lives of our young people, our children, our teens, and even our elderly. We have enough science, enough facts to prove that there is a product on the market that is killing us, that is killing people not only in our community, but in the community overall. It's time that we took action and changed the trends. And all we're asking for is a label. Start an education campaign. Put the label on the cans, on the drinks, and let our children and our adults make informed choices. Questions lead to dialogue. Dialogue leads to learning, and learning can change behavior. We must help our families in our community make these changes. Think about your own child. And if your child were drinking a soda with 16 teaspoons of sugar and you knew that that child was putting themselves at risk for diabetes, I don't believe you could tell me that you wouldn't take that can out of that child's hand. Please vote yes on this bill.
Thank you. There's no time remaining, but I will allow you to say a few words and make it brief, please.
Okay, my name is Nancy. I'm here from Latino Health Access. We are in Senator Wynn's district in Orange County, and we urge your aye vote today. I just want to say that we are seeing a travesty in our communities. This epidemic is bringing 5-year-olds that weigh over 100 pounds, and parents are telling us that they're feeding them soda or Sunny Delight in their bottles since they're 2 years old. We're seeing 8-year-olds being diagnosed with type 2 diabetes. We are seeing 15-year-olds that weigh 250 pounds that cringe going to school because they're getting bullied every day. We're seeing young people lose their eyesight in their 20s, losing their ability to drive and to work. And we have also more young men who have lost their battle with diabetes before they make it to 40. So we urge you today to please put a warning label on these sugary beverages, empower families to make an informed choice. We are asking you to support the right of Californians to make an informed decision when they are thirsty. We have the right to know if something that we're drinking is making us sick.
Thank you. Anyone else, please state your name and position.
Mr. Chair, Member Stephanie Roberson on behalf of the California Nurses Association, also in support of this important public health bill. Thank you.
Mr. Chair, members, Tim Madden, representing the California chapter of the American College of Cardiology, in support.
Tam Ma with Health Access California, in proud support. Thank you.
Bernadette Ariano on behalf of the California Children's Hospital Association, and very strong support.
Kimberly Chen with the California Pan-Ethnic Health Network, and very strong support.
Catherine Austin Scott, representing the California Academy of Physician Assistants and the California Naturopathic Doctors Association, and Olivia Alvarez in support.
Lynn Silver, pediatrician, speaking for the Public Health Institute and California Project Lean, in very strong support. Let people know. Thank you.
Judith Regal with the County Health Executives Association, in strong support.
Nicole Wertelman on behalf of the Alameda County Board of Supervisors, in support.
Chris Lev Twombly, Executive Director for the California State Alliance of YMCAs, in strong support. Several YMCA associations also in support.
Lydia Bourne, California School Nurses Organization, in very strong support.
Justin Rouser with Roots of Change, also in strong support. Thank you.
Kula Koenig on behalf of the American Heart, American Stroke Association, in strong support.
Rebecca De La Rosa with the Latino Coalition for a Healthy California, in strong support.
Terry Calgar-Hill on behalf of Children's Hospital Oakland, as well as the California WIC Association, in strong support.
Brianna Pittman with the California Dental Association. Pleased to be here in support.
Amber King with the Association of California Healthcare Districts in support.
Autumn Ogden with the American Cancer Society Cancer Action Network, also in support.
Alicia Sanchez representing the California Medical Association and our 40,000 members in support.
Christopher Castillo on behalf of the Napa County Board of Supervisors in support.
Erin Evans on behalf of the San Francisco Unified School District in support.
Chair members, Luis Sanchez with Blue Shield of California in support.
Jody Hicks with the California Academy of Family Physicians in support.
Brian Warren with the California Pharmacists Association in support.
Okay, seeing no more support, opposition.
Noe Paramo, California Rural Legal Assistance Foundation in support. Thank you.
Good evening. Please proceed.
Hi. Thank you, Senator Hernandez and members of the committee. My name is Dr. Liz Applegate, and I am the Director of Sports Nutrition and a tenured faculty member in nutrition at UC Davis. I teach the largest undergraduate nutrition course in California with over 3,000 students every year. I've authored a general nutrition textbook that's now in its 3rd edition, and I also serve as an expert resource to media on behalf of UC Davis to promote accurate nutrition information. Today, I'm testifying on behalf of the American Beverage Association, but the views I express are my own. I do not support SB 203, and I strongly encourage a no vote. I have 2 main points. Balancing calories consumed with calories burned is the key to controlling weight. I tell my students this. The body of scientific research and health authority statements actually reject the factual premise of this bill. Obesity is on the rise, and I applaud your concerns and efforts, but statements made by the proponents of this bill are simply not true. I want to point out that USDA research and CDC research shows sugar intake from sugared sweetened beverages has actually dropped. From the year 2000 to 2008, it has gone down by 37%. However, the rates of obesity and overweight have increased from 64 to 69% during these same years. We insult consumers by simplifying a complex disease and stating that sugared sweetened beverages cause their obesity. Obesity experts and nutrition educators will tell you that managing weight is about balancing calories in with calories out. And diabetes is absolutely a serious health concern, a topic I just covered in class, with multifactorial issues, lack of physical activity and genetics top on the list, as well as excess calories from any source as key factors. But again, the rise in diabetes is not associated with sugared sweetened beverage intake. Statements made by the proponents of this bill are not true. Added sugar intake has actually decreased from the year 2000 to 2008 by 25%, and sugared sweetened beverage added sugar intake has dropped by 37%. Unfortunately, the prevalence of diabetes has increased by about 1/3 in adults over this same time period. SB 203 singles out liquid sugar as a unique cause of obesity. I have to say, that's not something I teach in my University of California, Davis course. There is not scientific research supporting this, and according to materials cited by the bill's proponents, just over 50% of the people who drink 0 sweetened beverages in California are overweight or obese. What do we tell these people? Obesity and diabetes simply cannot be narrowed down to a one causative factor, and sugared sweetened beverages are not the cause. My second main point is that a warning label on sugared sweetened beverages would woefully misguide consumers and lead them to believe that sugared sweetened beverages are at the root for their risk of diabetes and a causative factor in their obesity. A safety warning focused on sugared sweetened beverages in isolation rather than other sources of added sugar, or for that matter, devices that decrease our activity levels, is simply not good policy. Focusing on sugared sweetened beverages is also inconsistent with the holistic dietary and activity approach that the draft 2015 Dietary Guideline Advisory Committee report advocates. Since sugar intake and sweetened beverage consumption has been on the decline the past decade, we have to ask, Why has not diabetes and obesity rates also declined? Identifying instead a comprehensive approach of prevention that involves the multifactorial components to these serious health problems is desperately needed. Not finding a scapegoat and what emotionally appears to be a quick fix. A warning label won't work, and I urge you to vote no on SB 203. And thank you for this opportunity.
Thank you. We have just a little over a minute and a half. Please proceed.
Mr. Chair and members, John Latimer on behalf of the California Retailers Association and PepsiCo. We are in opposition. It's important to note that we are not trying to prove sugar-sweetened beverages are health food, but it should be the burden of the supporters to show that sugar-sweetened beverages are so much more harmful to our diets than other foods and beverages that they deserve the first warning label of its kind the state of California has ever adopted. The proponents in the bill, and we don't believe that they can make that determination, and as you just heard from Dr. Applegate, the evidence doesn't exist. We don't think they have. The proponents of the bill and the bill's findings make a dramatic statement that's designed to push members to support the bill. The statement is sugar-sweetened beverages are the single largest source of added sugars in the American diet. That does sound scary, and that's something that we need to examine for a moment. What they are not telling you is that for the past 40 years, as you just heard, added sugars as a source of calories in the American diet have been flat, holding at a constant approximately 15% of total calories. And sugar-sweetened beverages within that balance of added sugars represents less than half of the calories from added sugar. Furthermore, they aren't saying that added sugars as a category of caloric intake ranks 4th out of 7 identified sources and categories of calories as tracked by the U.S. Department of Agriculture. So let's be clear, the supporters are asking for a warning label on a product class, sugar-sweetened beverages, that makes up less than half of the calories found, not in the first, not in the second, not in the third, but the 4th source of calories in the American diet. We aren't saying that those calories don't matter or that they shouldn't be counted. They should. But with flat to declining sugar-sweetened beverage consumption, sugar-sweetened beverages aren't deriving caloric intake. Now, we do believe that many sugar-sweetened beverages, sodas in particular, are treats. And in fact, there's no basis, and we're more than willing to call them treats. There's no basis to single that treat, sugar-sweetened beverage, a soda pop, out as the primary caloric threat. The data doesn't support that. And the only one needing of a label. Do we really believe that a warning label on a 150-calorie soda, calories which, by the way, are already displayed on the front of the package for every consumer to see, there's no hidden agenda about the caloric value, is critical information to a consumer when they aren't being told that this blueberry muffin has 612 calories in it and 40 grams of sugar, and to translate that into teaspoon, 10 teaspoonfuls of sugar. Or that this fat-free frozen yogurt, which we all love, and because it says fat-free, it sounds like it would be very healthy, that 11 ounces has 450 calories, 64 grams of sugar, or to translate into teaspoons, 16 teaspoons of sugar. Or that this strawberry milk has 460 calories, 60 grams of sugar, or to translate that into teaspoons, 15 teaspoons of sugar. All 3 of these are treat foods, clearly. There are thousands of others in our diet. Yet this bill singles out only sugar-sweetened beverages for a warning, and we think that is inconsistent and misleading. Nutrition information is very important to consumers and must be provided. I will. Apologize, Mr. Chairman. But this information should be provided in a forthright and open way. SB 203 leads consumers to believe incorrectly that sugar-sweetened beverages are the biggest nutrition threat that they face, and that simply isn't true. The state of California should not perpetuate that myth. Urge a no vote.
Thank you. If we can just state your name and position, please.
Catherine Pettibone, Civil Justice Association of California, in opposition. We are concerned about the unwarranted lawsuits that would be brought under 17200 in this bill, as well as the unjust joint and several liability against these companies.
Matt Sutton with the California Restaurant Association. The bill does have mandates for notice requirements for restaurants, and we're concerned about having to do that at the quote-unquote point of purchase, which is unidentified and would be very different in a quick-serve restaurant versus a full-service table service restaurant. So we are concerned about our ability to comply.
Thank you. Name and position, please.
Trudy Hughes of the California League of Food Processors in opposition.
Valerie Nair for the California Chamber of Commerce in opposition, and yes, it made the job killer list again.
Dean Hutchings, California Grocers Association in opposition. Bob Akron with the California Nevada Beverage Association in opposition.
Julian Canetti, California Asian Pacific Chamber, in opposition.
Thank you. Questions, comments from any of the members? I believe Senator Mitchell had a question.
It's really not a question. I'll just let you know it's a statement up front. And I don't know if it's the lateness of the hour or my age or what. But, you know, this body as a whole, not just the Senate, but the entire legislature, has a real historic, inconsistent track record on really meaningfully addressing the issue of obesity. And I find that irritating. I was committee consultant years ago when the senator took up the issue of taking the soda out of schools. And, you know, the kinds of arguments that attempted to justify why it made sense to leave soda vending machines in schools were, you know, offensive at best. Everyone in here understands that sugar-sweetened beverages contribute to levels of obesity. I don't, as a co-author of the bill, it's not my intention to suggest that it's the only contributor. But when I consider the level of obesity amongst Black and Latino girls in South LA in my district that I see every day, they're not in your classroom apparently at UC Davis, nor are the practitioners who serve them, unfortunately. When I see that the epidemic proportions that we are dealing with, the impact it will have on their long-term life expectancy, the impact it's going to have on us as California policymakers, as taxpayers, in terms of the long-term public health implications, the fiscal implications, in terms of our Medi-Cal costs, our PERS costs for state employees. This body has got to figure out how to have a meaningful conversation about this as a public health issue. And so we dance around the issue and want to talk about personal rights and not want to violate folks' personal rights in terms of what you know, they should be able to do. We've had that conversation on the vending machines in state buildings, et cetera. It is a public health issue, and we've addressed other critical public health issues in this committee just in the last couple of weeks. Is this the end-all, be-all? No. As a person who counts freaking calories in my sleep, in my own effort to manage obesity, given my own family history, I appreciate how complicated that is. From my perspective, and the reason I am a co-author with you, is recognizing what our lack of focused attention from a public policy perspective on obesity issues has done to my community and communities across this state. And I am hoping that at some point we can engage in a dialogue that rises above the economic interests of certain sectors to talk about it in the capacity that it should be, that it is a public health crisis facing this nation. And with that, I would like to move the bill.
We do have a motion by Senator Mitchell. I believe Senator Pan, and I think Senator Walk also had a comment or question. Senator Pan.
Okay. Thank you. I know it's getting late, but I do have some questions. I too was, before I came to the legislature, for a few years after, professor at UC Davis on faculty in pediatrics and community development, and I do have a background in public health. I know certain claims were made, or statements were made regarding research, but I just want to, but perhaps some people can clarify this for me. So certainly there's statements said, you know, calorie is a calorie, and the calorie is actually a unit of energy. So in that sense, yes, a calorie is a calorie, and doesn't matter where it comes from. No, in terms of overall mass or obesity, but I think there are some particular characteristics of sugar-sweetened beverages that I want to touch on, because at least talking to my colleagues who are really more specialists in obesity, I've heard from them, people, endocrinologists, so forth, particular concerns about this form of intake of these calories, not because they're calories, but the way they're metabolized and so forth. So I guess, one question perhaps for the expert on that Senator Monning brought. Can you tell me, in terms of consumption of sugar-sweetened beverage, what, we talked about type 2 diabetes. You know what? And type 2 diabetes is certainly associated with obesity, but yet not everyone who's obese gets type 2 diabetes, right? And so can you maybe touch a little bit on metabolic syndrome, which leads up to diabetes, and the role that sugar-sweetened beverages play in development of the metabolic condition that might be a little different than anything else that other types of foods or other types of foods that people may consume?
Yep. No, it is a really good question. You know, when we were pushing to get soda and junk food out of schools, so this was starting in 1999, the general sense was all foods fit into a healthy diet. Why would you possibly get candy bars and sodas out of schools? That's just not fair. That's not consistent with the science, right? This message that comes out that says a calorie is a calorie, would you want your kids or your grandkids drinking soda as their only source of calories, right? Does it matter if they eat any broccoli or if they eat only broccoli? It's a whole different ballgame. So what's being shown conclusively is that sugar has a harmful metabolic effect, and that liquid sugar is particularly harmful, as Senator Monning said, because it's absorbed so quickly. A recent study out of Kimber Stanhope, out of UC Davis, clinical, gold standard clinical study, showed that within the clinical setting where they aren't deciding what to eat, they are given what to eat. In just 2 weeks, their LDL cholesterol, their bad cholesterol, goes up 20%. After 6 months, the amount of fat in their liver goes up 150%. That's with no change in their total calories. That's if you move from non-sugar calories, actually just regular carbohydrate calories, to sugar calories. That's what metabolic syndrome is it's this damaging effect on your pancreas and your liver. And I mean, of course, you can find somebody who's going to say that's not what the science shows. You can find somebody to say anything. We've got a list of 30 top researchers, that the former head of the Centers for Disease Control Nutrition section, right? Everybody's in agreement within the science community that this sugar, this liquid sugar, is particularly harmful. When a child drinks 1 soda a day, they're 55% more likely to be overweight. When an adult drinks 1 soda a day, they're 26% more likely to have diabetes. Those are the clinical studies done.
Mr. Chairman, if we could have Dr. Applegate respond to the issue raised.
May I respond, Senator Fan?
If you don't mind, would you like her to respond?
We'll give you briefly.
Okay, briefly, metabolic syndrome, which I teach in class, I've written articles and books about, has a multitude of causes. It's a condition where insulin becomes resistant. It doesn't work very well in the body. And if you do look at research, and I know Kimber Stanhope, and I've evaluated that research, they actually gained weight during that study. It's important to note, we have to look at the numbers. The study you keep citing is actually a point in time and is not addressing that from 2000 to today, our sugared sweetened beverage intake has gone down. Our added sugar intake has gone down. Our calorie intake has gone up. Our activity level has gone down. We're obese and diabetic. It's no surprise to scientists. There are other issues behind metabolic syndrome.
Okay. Well, I appreciate what you said. Actually, interesting enough, you are not citing studies specific to metabolic syndrome. And so the information I've seen from people who are experts in the field of obesity, at least in pediatrics, that I think comports more, actually, neither of you are disagreeing with each other, actually.
Exactly.
That's the thing. You've cited data about rates of consumption and so forth, and that's great, but that doesn't down about by metabolic syndrome, which is a mechanism that takes place. I think the other issue is also in terms of the feedback loop in terms of satiety and so consumption, right? So it's whether people are more likely to consume is also an issue as well. And I agree. There's multiple sources of calories that you can get in. I think one can, talk about the different sources. I think there is both because of this metabolic mechanism and also in terms of like, sort of nutritional cost benefit, right? So there's certain things that you eat that have a certain, we talked about broccoli, but maybe that's not a good example. And there's probably some things that have a certain amount of nutritional, and then there's some calories attached to that. And there's other things that really the nutritional benefit is quite minimal. So essentially, yeah, I mean, I guess you can call them, and I don't know what the term was, entertainment or enjoyment, but treats. But the problem is that when a treat starts becoming risky to your health, I think, and I appreciate what Senator Manning's doing, this is not a ban or limitation on consumption. This is a notification. And we've talked about how we want to warn people and educate people. And also, I think, and I've met with, and I hope that hopefully that will help in terms of choices, but also my guess is people still drink something. And that I think there's an opportunity here also as well for for people in the beverage industry to think about, in terms of shifting where the focus may be in terms of what you're selling. We want to keep those jobs and we want to keep the businesses going. But I think that there are, there's many things to drink. Actually, even the former president of Coca-Cola said our biggest competition is really water. It's not, so I think there are other options, but I think it's another subject, but I do appreciate the discussion, and I will certainly be supporting the bill. I do think the science is in support that saying that there's a rationale, or at least for this bill. We can talk about rationales for other things we should be doing. This is a very limited thing we're doing, but I do think that the rationale is there. Thank you.